Hi, I'm Sarah Jasim. I've been working at the Care Policy and Evaluation Centre at LSE for about 4 years now. I joined in the pandemic and I've been working on sort of programme evaluation, sort of complex interventions, trying to understand what works for whom and in which circumstances and contexts, particularly around adult social care. So the research interest sort of stemmed from a really long time ago. My grandma was diagnosed with Alzheimer's when I was very, very young, and I've worked in different health and social care settings from a really young age, from pretty much like 14, 15. I am funded by the National Institute for Health and Care Research, so NIHR, Applied Research Collaboration North Thames. So it's one of many applied research collaborations across England. And the idea behind these applied research collaborations is that they're essentially clusters of anybody sort of working on health and care research in that regional area. So within North Thames, there's 5 educational partners. So LSE is one of them. And the idea is that researchers work really, really closely with practitioners and policy professionals. So from inception, the research is co-designed with those practitioners' demands and issues and sort of research problems in mind. And very recently, for the last 2 years, I've also been taking up a policy fellowship within the Greater London Authority, and that's specifically focused on knowledge brokerage services, so trying to understand how researchers can work better with sort of regional policy professionals and practitioners, and by working in this way, how this improves not just the research projects and the outputs that come out, but also how research evidence is used in decision making. Often for academic researchers, our research priorities are set by national bodies, national governments, funding bodies, and these kind of organizations that might not have the real understanding of local or regional issues. And so therefore the research that's produced is very in alignment with those priorities, but perhaps not with local populations and the needs of policy professionals and practitioners. So that really creates a divide, and then you end up with lots of research that might have lots of great uses, but then it's maybe not having engaged those policy professionals and practitioners earlier in your research, not even having the funding or the time to do that appropriately and kind of in a well-resourced manner. And that really creates this divide, which the research that I'm trying to do, and particularly with the organisation I did my fellowship with, the London Research and Policy Partnership, really trying to tackle those divides and instead have bridging mechanisms and knowledge brokerage services and ways of working that really try to tackle that. When I first came into this role at the Care Policy and Evaluation Centre, I was fairly new to social care research, and particularly the regional priorities of social care practitioners within the North Thames region. So my colleague, Dr. Fiona Aspinall, and myself, we undertook a series of scoping consultations, sort of 2021, 2022. It was the pandemic, so everything took a really long time. And we began to engage with sort of principal social workers, assistant directors, and directors of adult social care in all of the local authorities and kind of some surrounding ones to the North Thames regions. And we asked them what their local sort of priorities were and problems that could be answered by research. So one of the biggest kind of research demands was this kind of issue of trying to understand the needs of diverse populations. And that kind of really links into trying to understand and maybe also predict future demand for adult social care services. So this led to really co-producing this research project with the 2 directors of adult social care in the London Borough of Newham and the London Borough of Redbridge. And I think it was really critical to the success of the project, because having that buy-in really helped to unlock lots and lots of sort of communities, stakeholders, people within the local authorities. And it's really kind of helped the research not just have the necessary people behind it and have that sort of engagement, but also really feel like you're making a difference with the research because you know how the local authority are going to use the research once it's finished. Since being at the Care Policy and Evaluation Centre, it has really opened my eyes up to so many different networks and ways of working, different methodological approaches. We have such a wealth of social care experience and methodological expertise within the centre itself. It's a lovely, friendly place to work, which always makes everything better. But also being placed within the wider Department of Health Policy and having other sort of departments and institutes at LSE. So, for example, I work quite closely with LSE Cities in my work. I've interacted with government and sociology and other departments as well. I think I'm really excited about some of the findings from my research and particularly hearing about those from my colleagues. I think that we are really moving the dial, particularly when it comes to kind of minoritized communities or lessening inequalities or inequities within adult social care, which has historically been a really, really ongoing problem, not just in England, but in other social care contexts across the world.